You have been buying the same box every 6 weeks for years. Different brand maybe, different shade, but the same routine. Maybe you have stood in that same aisle more than once, comparing two nearly identical shades, wondering if anyone would even notice the difference, while the actual answer was never on that shelf to begin with. Here is what nobody in that aisle tells you. For a real percentage of people over 60, gray hair is not aging showing up early. It is a warning light your body has been flashing, and dye does not turn off a warning light, it just paints over it. What if the money you have spent hiding your roots was actually the clue you needed to catch something else in your body before it became a much bigger problem? Before I show you the exact vitamin and the exact number to ask your doctor for, hit subscribe if you are over 50 and you want the kind of health information nobody hands you at a routine appointment. This channel exists because information like this should not be locked behind a 15-minute visit. Join a community of people who are done being surprised by their own bodies. By the way, my name is Dr. Matthew Clark. I am an internal medicine and preventive health doctor, and I have spent the last 15 years working with patients just like you, men and women over 50 who are trying to protect their health before something goes seriously wrong. I did not start looking into gray hair because it is glamorous. I started because 3 patients in one single month came in for something else entirely, and all 3 had the same overlooked lab value staring back at me. None of them came in asking about their hair. They came in tired, or achy, or foggy, and the hair only came up when I started asking the right questions instead of only the expected ones. I think about those 3 patients often because it would have been so easy for any one of them to walk out of my office with nothing more than a compliment on how well they were aging. Before we go further, I want to ask you something. Has a doctor ever actually ordered a blood test the very first time you mentioned your hair going gray, or did the conversation stop at, "that just runs in the family"? Type yes or no below. I read every single comment and it shapes what I cover next. I ask because so many of you have told me before that a concern got waved away with a single sentence, and I want to know how often that happened here too. Here's where it gets interesting. Inside every single hair follicle on your head sits a small cluster of cells called melanocytes. Their entire job, day after day, is to manufacture the pigment that gives your hair its color. Think of each one as a tiny paint factory built directly into the root. Now that factory does not run on nothing. It needs raw material delivered constantly, and one of the most important deliveries comes from a vitamin most people have never had checked, vitamin B12, also called cobalamin. When that delivery truck stops showing up, the factory does not shut down all at once. It slows, it sputters, and eventually it starts producing hair with no pigment in it at all. That is one form of what shows up in the mirror as gray. I want you to actually do something right now, not later. Take your fingers and gently part your hair close to the scalp, right at the root in 2 or 3 different spots. Look closely at the very base, not the length, the base. Pay attention to whether the gray is spread evenly across your whole head or concentrated more heavily in patches, since a more uniform pattern tends to track with genetics, while a newer, faster, more irregular pattern is one of the details that makes a deficiency more worth investigating. Some of you are going to notice something I want you to sit with for a second, and I will come back to exactly what that means in a few minutes. Take a photo if you can, dated today, because in a few months, you are going to want an honest comparison instead of relying on your memory of what your roots looked like before. Vitamin B12 does far more than feed your hair. It is required for your body to build healthy red blood cells, and it is required to build the protective coating around your nerves, similar to the rubber insulation wrapped around an electrical wire. When that coating wears thin, the signal running through the wire starts to short out. That is why a real B12 deficiency rarely shows up as only gray hair. Doctors often see it paired with fatigue that sleep does not fix, tingling or numbness in the feet, and trouble with memory or concentration. And in older adults, it is sometimes mistaken for ordinary aging or early cognitive decline when the actual cause is sitting in a blood panel nobody ordered. Here's the second piece. Every cell in your body that divides quickly needs vitamin B12 to copy its own DNA correctly, and hair root cells are some of the fastest dividing cells you have. Picture a printing press running non-stop, day and night, and B12 is the ink cartridge. When the cartridge runs low, the press does not stop printing, it keeps going, but the pages start coming out lighter and lighter until eventually they are blank. That is a simplified picture of what can happen at the cellular level when this vitamin runs short for an extended period. Hair is also one of the more visible ways this can show up early, because unlike your internal organs, you look at it in the mirror every single morning. Your body tends to prioritize survival over appearance when resources run low, sending whatever is available first toward your heart, your brain, and your blood, and treating pigment production as expendable by comparison. That is part of why hair can change before you ever feel something is seriously wrong internally. A normal vitamin B12 level typically falls somewhere between 200 and 900 picograms per milliliter depending on the lab, and many physicians now consider anything under 300 worth investigating further, especially in someone over 60, since absorption naturally declines with age. This type of deficiency becomes more common with each decade after 50, and by the time someone reaches their 80s, a meaningful minority show laboratory evidence of at least a mild deficiency, whether or not they have ever been tested for it. Research consistently links low B12 status with premature and accelerated graying, and case reports described in the dermatology literature include patients regaining natural pigment within months after correcting a confirmed deficiency. I want to be honest with you, this is not a guarantee, and it will not reverse graying that is purely genetic or purely related to the normal aging clock. But if a deficiency is part of your picture, correcting it gives your body's paint factory the raw material it has been missing, and in some people that shows up as new growth returning with color. Now let me address the myth directly, because I hear it constantly. Most people believe gray hair is completely genetic, completely fixed, and once it starts, there is nothing left to do except cover it. Here is the reality. Genetics absolutely plays the largest role in when graying begins for most people. Nobody is disputing that. But layered on top of genetics, for a meaningful number of people, sits a second, correctable factor, a nutrient deficiency that genetics did not cause and dye cannot fix. Treating gray hair as 100% fixed means some people spend years covering up a problem that a simple blood draw could have identified. A few groups face a meaningfully higher risk of this specific type of deficiency. The first group is anyone following a mostly plant-based diet for many years, since vitamin B12 occurs almost entirely in animal-derived foods. The second group is anyone taking a long-term acid-reducing medication, the kind used daily for reflux because stomach acid plays a role in releasing this vitamin from food in the first place. The third group is anyone managing type 2 diabetes with metformin over a period of years, since it is well documented that metformin can lower B12 levels the longer it is used. A fourth group worth mentioning is anyone who has had stomach surgery of any kind, including weight loss surgery performed years earlier, or anyone who has ever been treated for a stomach infection called H. pylori, since both can permanently change how much of this vitamin the body is able to pull out of food. None of this means you did something wrong. It means you have a specific, identifiable reason to ask for the test by name instead of waiting for it to come up on its own. There is also a completely separate mechanism worth understanding, since gray hair is rarely caused by only one thing. Inside every hair follicle, a natural byproduct called hydrogen peroxide is produced constantly as part of normal cell activity, and a protective enzyme called catalase is supposed to break it down before it causes damage. As we age, catalase activity naturally declines, and hydrogen peroxide can build up inside the hair shaft itself, essentially bleaching the hair from the inside, similar to how peroxide is used to lighten hair from the outside in a salon. This particular process is largely tied to genetics and general aging, and correcting a vitamin deficiency will not reverse it, which is exactly why I do not want you walking away from this video believing one vitamin explains all gray hair. It explains a meaningful piece of the picture for some people, not the whole picture for everyone. One more piece worth understanding. As we age, the stomach produces less of a substance called intrinsic factor, a protein required to absorb vitamin B12 from food. When intrinsic factor drops low enough, it can lead to a condition called pernicious anemia, which in plain terms simply means the body can no longer absorb this vitamin properly no matter how much of it is eaten. This is one of the most common reasons B12 deficiency shows up specifically in people over 60, even in those eating a well-balanced diet. I also want to give you language that helps you advocate for yourself, because a standard B12 blood test alone can sometimes sit in a gray zone, no pun intended, where the number looks borderline normal, but the body is still struggling to use what is there. When that happens, 2 additional blood tests can settle the question. The first is called methylmalonic acid, often shortened to MMA, and the second is called homocysteine. Both of these tend to rise when the body is not using B12 properly at the cellular level, even if the basic B12 number looks acceptable on paper. If your regular B12 result comes back in that gray zone and your doctor is unsure whether to treat it, asking about these 2 follow-up tests by name is exactly the kind of question that moves the conversation forward instead of ending it. I see this pattern constantly in my practice. A patient comes in describing months of unexplained tiredness, maybe some numbness creeping into their toes at night, and almost as an afterthought they mention, "Oh, and my hair went completely gray within about a year, faster than anyone expected." We run one simple blood panel, and there it is, a B12 level low enough to explain every symptom on that list, including the hair. Once we correct it with the right approach, the fatigue lifts first, the nerve symptoms improve over the following months, and several months after that, the patient comes back and points at their own scalp, at new growth coming in with actual pigment in it, and asks me if they are imagining it. They are not imagining it. This particular pattern shows up often enough that I now ask about hair changes specifically whenever a patient over 60 mentions fatigue or numbness in the same visit, even if they never bring the hair up themselves, since in my experience, patients rarely connect the 2 on their own. Another version of this same pattern shows up in people who never had a single other symptom at all. A patient in her early 60s came in for a completely unrelated yearly physical, and her graying had started so gradually over 10 years that neither she nor her family ever questioned it. It only surfaced because a routine complete blood count showed slightly enlarged red blood cells, a small clue that is easy to miss unless someone is specifically looking for it. That one incidental finding led us to check B12, and there it was again. She had spent a decade assuming her hair color was simply following her mother's timeline, when part of it was something entirely fixable that nobody had ever thought to check. Here is something worth sitting with. There is no billing code that rewards a 5-minute conversation about checking your B12 level before you reach for another box of dye. The system is built to sell you a cover-up, not a blood test, because a cover-up is a product and a blood test is only information. I have had patients tell me their insurance would not cover a basic B12 panel unless a specific symptom was already documented, which means the very test that could explain a symptom has to wait for proof that symptom already exists somewhere else on paper first. I am not telling you this to make you angry at anyone specifically. I am telling you because once you understand the incentive, you understand why you have to be the one who asks the question first. Think about how often a 15-minute appointment gets filled entirely with the loudest, most urgent complaint on your list, leaving no room to mention something that feels cosmetic, even when it is actually a clue. If there is one person in your life who has been quietly covering their gray for years and telling themselves it is just genetics, send them this video right now, today, not later. It might be the reason they finally ask for the right test instead of the wrong shade of dye. And if this is the kind of information you want more of, be part of this community, hit subscribe, because every person who joins tells me this content is actually reaching the people who need it. And that is what keeps me making more of it. Somewhere out there is a person who has quietly accepted their gray hair as just one more thing aging took from them. And I would rather that person hear the honest truth from you today than never hear it at all. I want to ask you something, and I genuinely read every answer. How old are you right now, today? Please tell me in the comments. I ask because it changes exactly what I recommend for someone in their 50s versus someone in their 70s. And it directly shapes what topic I choose to cover in my very next video. Here is a number that stops most people in their tracks. Some research estimates that a meaningful percentage of adults over 60 have a vitamin B12 level low enough to cause symptoms and never get tested for it during a normal annual physical, since it is not part of the standard basic panel most doctors order automatically. That means the deficiency behind someone's gray hair, their fatigue, and their nerve tingling can sit undiscovered for years unless the patient specifically asks for it by name. Sit with that for a second. It means somebody you know, maybe even you, could be walking around with this completely undiagnosed right now, attributing every one of these symptoms separately to nothing more than getting older. I promised I would come back to those 3 patients from earlier, the ones who came in for something else entirely, and here is the resolution. All 3 had a B12 level under 200. All 3 had been dismissed years earlier when they first mentioned their gray hair as, well, that is just genetics. Correcting one overlooked lab value in each of them did not just address their fatigue and the tingling in their hands, it also, months later, gave 2 of the 3 visible new pigment at the root. The 3rd patient's graying turned out to be almost entirely genetic, layered on top of a mild deficiency. And honestly, that is how it goes for a lot of people. It is rarely 100% one cause or the other. I share their outcome with you not to promise you the exact same result, since every body responds differently, but to show you what asking one more question at the right visit can uncover. One more question before we get to your action plan. Has anyone ever brushed off a health concern of yours by calling it just aging when it turned out to be something else entirely? Tell me your story in the comments, and tell me what topic you want me to cover next, since half of what I make comes directly from what this community asks for. I read these more closely than almost anything else I get because a comment section full of real stories tells me far more about what this community actually needs than any list of trending topics ever could. I want to prepare you for something honestly, because this is where most people quit, and it is exactly the wrong moment to quit. Somewhere around 4 to 6 weeks after correcting a true deficiency, your energy improves, the tingling starts to fade, and you feel almost entirely normal again. That is precisely when most people stop paying attention, because the scary symptoms are gone and life gets busy again. But the hair pigment change, if it is going to happen at all, takes months longer than the energy does, since hair only grows about ½ an inch per month, and new pigmented growth has to work its way out from the root. Feeling better is not the finish line. It is the sign that the real repair work is only just getting started underneath the surface. I say this because I have watched patients stop their follow-up labs the moment they feel good again, and then wonder 6 months later why nothing changed with the hair, when the honest answer is they simply were not around long enough to see it. One more thing worth understanding before we get to your action plan. If a deficiency is confirmed, there is more than one way to correct it, and the right one depends entirely on why the level is low in the first place. For someone whose diet is simply lacking the vitamin, an oral tablet or a dissolving sublingual form placed under the tongue is often enough, since the digestive system is still working normally. For someone with pernicious anemia or another absorption problem, swallowing more of the vitamin often does very little, since the issue is not supply, it is delivery, and an injection that bypasses digestion entirely may be needed instead, at least at first. This is precisely why guessing at your own supplement aisle is rarely the fastest path back to normal, and why the earlier step about talking with your doctor before starting anything matters as much as it does. Before we move into your action plan, I want to answer 4 questions I get asked constantly whenever this topic comes up. The first question, does biotin help with this? Biotin gets enormous attention in the hair world, but for gray hair specifically, the evidence is thin. A true biotin deficiency is genuinely rare, and taking more of it when you are not deficient generally does very little for pigment, even though it may support the strength of the hair strand itself in other ways. The second question, if my level is corrected, will my hair color come all the way back to exactly what it used to be? I wish I could promise that, and I cannot, since it depends entirely on how much of your graying was caused by the deficiency versus how much was already following its natural genetic timeline underneath it. Some people see a meaningful amount of color return, others see the process simply stop getting worse as quickly. Both are real possible outcomes, and I would rather tell you that honestly than promise something I cannot guarantee. The third question, can I just eat more meat and eggs instead of correcting this through medical treatment? For some people with a purely dietary cause, yes, increasing foods like eggs, dairy, fish, and lean meat can genuinely help, since these are some of the richest natural sources of this vitamin. But if your deficiency comes from an absorption problem rather than a dietary gap, eating more of these foods will not solve it, because the issue was never how much you were eating, it was whether your body could actually use it. The fourth question: is vitamin B12 the only nutrient connected to hair color? No, and I want to be honest about that too. Copper deficiency is a separate, less common but real contributor, since copper is required for an enzyme that helps produce melanin, the same pigment we talked about earlier. Zinc and certain thyroid hormones play supporting roles as well. This is exactly why, if your B12 comes back completely normal, the conversation should not stop there. It should widen to include these other possibilities instead of assuming a normal B12 level means nothing else is worth checking. Here's exactly what I want you to do, step by step. The first step: ask your doctor specifically for a vitamin B12 blood test by name. Do not just accept a general senior wellness panel, since B12 is not always included automatically. The second step: if your level comes back low, ask specifically whether the cause is dietary, absorption-related such as pernicious anemia, or medication-related, since certain long-term medications, including some used for acid reflux and for diabetes, can lower B12 over time. The third step: do not start a high-dose B12 supplement or injection on your own before that conversation, since the correct form and dose depends entirely on why your level is low, and this is a step where you should talk to your doctor before starting anything. The fourth step: revisit the same root area we looked at together today, once a month, in the same lighting, so you have an honest before and after record instead of relying on memory. The fifth step: support the process from the outside as well as the inside. A few minutes of gentle scalp massage daily to support circulation to the follicle, sun protection for your scalp and hair, and adequate protein intake, since hair is built largely from protein, and this costs nothing beyond a few minutes of attention you are already spending in front of a mirror. The sixth step: track your energy and any nerve symptoms alongside the hair, since the fatigue and tingling will likely improve faster and give you an early signal that correction is working before the hair catches up, and a simple notebook or phone note is enough. It does not need to be complicated. The seventh step: if your level is normal and graying is your only symptom, do not force this cause onto a purely genetic pattern. Ask your doctor about a broader panel including thyroid function and copper levels instead, since those are two other correctable contributors worth ruling out. The eighth step: give the full process patience, a minimum of 3 to 4 months, before deciding whether pigment is returning, since judging it too early is the single biggest reason people give up before they see any change at all. Thank you for spending this time with me today. Genuinely, if even one person watching finally asks for that blood test instead of reaching for another box of dye, this video did exactly what I made it to do. If you want to keep learning what your body has been quietly trying to tell you, stay close to this channel, subscribe if you have not, and keep showing up for yourself the way you just did today. One last thing before you go. I am sharing general medical information here, not a diagnosis for you individually. Every single body is different, and blood work is the only real way to know what is happening inside yours. Please talk with your own doctor before making any changes, especially around supplements or dosing. Take care of yourself, and I will see you in the next one.